One of the most important roles of local government is to protect people from harm. This includes helping people prepare for and respond to emergencies and disasters. Making local government emergency preparedness and response programs accessible to people with disabilities is a critical part of this responsibility. Making these programs accessible is also required by the Americans with Disabilities Act. How do we make emergency management programs accessible? People with disabilities have the right to participate in and receive the benefits of all emergency programs, services, and activities at the same time as people without disabilities. People with disabilities must also be able to access locations, enter and navigate the structure, and move about different parts of facilities where emergency programs and services are provided. People with disabilities must be given the same information provided to non-disabled people at the same time and in a manner that they can understand. Emergency programs must also make reasonable modifications to policies, practices, and procedures when necessary to ensure people with disabilities can access programs and services.
These general requirements apply to emergency response programs run directly by state and local governments, as well as those led by third parties, such as the American Red Cross, private nonprofit organizations, and religious entities. The ADA applies to a wide range of programs, services, and activities related to emergencies and disasters, including steps taken preparing for, responding to, and recovering from emergencies and disasters.
An emergency management plan is the all-important first step in ensuring an effective response to emergencies and disasters. Seeking and using input from people with a variety of disabilities and organizations with expertise on disability issues will help ensure that your emergency planning and preparedness meet the access needs of people with disabilities in your community with respect to all phases of emergency management. Often, using a combination of notification methods will be more effective than relying on one method alone. For example, combining visual and audible alerts will reach a wider audience than either method would alone. For announcements by government officials on local TV stations, providing qualified sign language interpreters and open captioning will ensure that all people tuning in are able to access the information provided.
During an emergency, it is critical to transport and evacuate people. But in an emergency, people with disabilities may face a variety of challenges in evacuating to safety. A person with a mobility disability may need assistance leaving a building without a working elevator. Individuals who are blind or who have low vision may not be able to use traditional orientation and navigation methods alone. An individual who is deaf may be trapped somewhere and unable to seek help because the only available communication device relies on voice. State and local governments need to establish procedures to ensure that people with disabilities can evacuate the area of an emergency in a variety of conditions, with assistance when it is needed.
The movement of people during an evacuation is critical, but many people with disabilities don't drive or use traditional and often inaccessible transportation. That's why emergency plans should identify accessible forms of transportation that are available to help evacuate people with disabilities.
One step that can increase the effectiveness of your planning process is to create a voluntary, confidential registry of persons with disabilities who may need individualized notification or evacuation assistance. Setting up a voluntary registry requires that procedures be implemented to ensure that the registry is voluntary, confidentiality is protected, and information is updated as needed.
When emergencies arise, communities often provide residents and visitors with safe refuge in temporary shelters.
For many people without disabilities, any building designated as a shelter will meet their basic emergency needs, so long as it provides a safe place to eat, sleep, and take care of personal hygiene needs. But an emergency shelter is of little use to a person using a wheelchair if it has steps at the entrance or toilet rooms she cannot use.
Emergency managers and shelter operators need to ensure that sheltering programs are accessible to people with disabilities, including individuals who use wheelchairs. So you should survey physical spaces for barriers and ensure they comply with the ADA standards. Make sure that shelter staff maintain accessible routes and minimize protruding objects.
Many emergency shelters do not allow residents or volunteers to bring their pets inside, but shelters must generally modify no pets policies to allow people with disabilities to be accompanied by their service animals. Most shelter operators restrict residents and volunteers access to the kitchen to preserve food and beverage supplies and maintain efficient kitchen operations. But people with medical conditions such as diabetes may need immediate access to food to avoid serious health consequences. Shelter operators need to make reasonable modifications to kitchen policies so that residents and volunteers with disability-related needs can have access to food and beverages when needed.
Many shelter residents and volunteers might have communication-related disabilities. Advanced planning is critical to ensuring effective communication during an emergency. Without such planning, it may be difficult or impossible to locate communication aids and services and have them available and ready for use at the shelter.
People who are blind or who have low vision may request documents and brochures in alternative formats, such as Braille, large print, or an audio recording. Generally, shelter supplies should include alternate format versions of documents that are routinely made available to shelter residents. Often, the most effective solution in an emergency is to provide a person to read printed documents and, where applicable, someone to help fill out forms. In emergency shelters, most information is conveyed through oral announcements. Shelter operators must ensure that people who are deaf or hard of hearing have access to this information in a timely and accurate manner. In some circumstances, qualified sign language or oral interpreters may be required by the ADA. In others, posting messages and announcements in written format on a centrally located bulletin board or writing notes back and forth with residents who are deaf or hard of hearing may suffice. The ADA requires state and local governments to provide services to people in the most integrated setting appropriate to their needs. There are generally two types of shelters: mass care shelters for the general population and other shelters like medical shelters. Medical shelters provide a higher level of medical care for people who are medically fragile. Most people with disabilities do not require the care provided at medical shelters. State and local governments should plan and prepare to house people with disabilities in mass shelters, including those who need some medical care, medication, equipment, and supportive services.
To do this, state and local governments can take several steps. They can train staff and volunteers to help people with disabilities with daily living activities, like transferring someone to and from their wheelchair. They can ensure there are backup generators and a way to keep medications cold. They might also provide stress relief zones for people whose disabilities are aggravated by stress.
State and local governments often provide social services and other benefit programs to assist people harmed by emergencies and disasters. These programs need to be accessible to all, including people with disabilities. Procedures that allow people to apply in different ways, providing auxiliary aids and services and reasonable modifications to application procedures when people with disabilities need them, is the most effective way to ensure equal access. Remember, include people with disabilities as you plan for and respond to emergencies and disasters. Doing this can ensure the safety of the entire community.